to another YouTube video. Today's episode, we're going to talk about oral contraceptives, right? Yes. So many people have asked me questions about oral contraceptives. So today, let's do a video. Let's learn about oral contraceptives, right? So I'm going to talk about combined oral contraceptives and progestin only contraceptive, right? Yes. So in this episode, I'm going to talk specifically about who should not use oral contraceptives, right? The contraindications of oral contraceptives, right? So basically, before we start, let's understand what oral contraceptives are. So basically, oral contraceptives are steroid hormones, right? So they can contain a combination of estrogen and progesterone, what we call combined oral contraceptive, combination of estrogen and progesterone, or it can only contain progestin only, what we call progestin only pills, right? Yes. So these are basically steroid hormones that we consume or we take so that we plan our family, right? So for family planning purposes, right? So there are people, right? There are ladies, there are women who cannot use combined oral contraceptives, a combination of estrogen and progesterone, or who cannot use progestin only pills, right? Because of one or two reasons that we are going to mention in a way, right? So having said so, right? Having said so, we have to understand that there are mechanisms of action of both combined oral contraceptives and progestin only pills, right? So how does they work? Basically, how does they work? So combined oral contraceptives or for the progestin only pills, basically they inhibit the release of a hormone called gonadotropin releasing hormone, right? So if they inhibit the release of this hormone, there will be no release of the pituitary hormones, the likes of luteinizing hormone, the likes of follicle stimulating hormone, which play a very major role as far as the human menstrual cycle is concerned, right? So if there's an inhibition in the release of gonadotropin releasing hormone, there will be an inhibition in the release of the pituitary hormones, which if you don't release the pituitary hormones, basically there will be no ovulation, right? So if there's no ovulation, what happens? Basically you're not going to conceive, right? So apart from inhibiting ovulation through the inhibition of gonadotropin releasing hormone, they can also affect the wall of the endometrium, right? So if they affect the wall of the endometrium, basically implantation will not take place, right? With no implantation, again, you're not going to carry that pregnancy term, right? Yes. So apart from that, they can also thicken the cervical mucus. One of the conditions for fertilization to take place is the mucus, the cervical mucus should favor the passage of sperms, which in this scenario will not take place, right? Because these hormones, the estrogen plus progesterone, they thicken the cervical mucus. So again, the passage of sperms to reach the oviduct will be difficult, right? So fertilization will not take place. Having mentioned that, there are a group of women, maybe there are a group of ladies or girls who cannot use the combined oral contraceptive, a combination of estrogen and progesterone pills, right? Or the progestin only pills. They cannot use because of one or two reasons that we are going to mention, right? So one among this group one of them is less than 21 days post delivery, right? In less than if let's say you've just given birth, you are 2 weeks old since you gave birth, right? Or less than 3 weeks, you're not supposed to use the combined oral contraceptive pills, right? Yes. Why? Because during this period, when you take the combined oral contraceptive, that's a combination of estrogen and progesterone, there's high likelihood that there are increased chances that there will be formation of blood clots, right? So the formation of blood clots can complicate to some things we call we have different thrombosis, right? So during this period, there's a high likelihood of blood clotting, right? So if again you take estrogen, right, you are increasing the chances of blood clotting, right? So that's why combined oral contraceptives are contraindicated in less than 21 days, less than 3 weeks post delivery. Again, if just gave birth, right, you have to, if you are breastfeeding on demand, that is exclusive breastfeeding, right, you have to wait for at least 6 weeks for you to start the combined oral contraceptive, right? So the first contraindication is less than 21 weeks post delivery, right? Yes. Apart from that, we have women or girls who have different thrombosis, what we call DVT or thromboembolism. Again, combined oral contraceptives are indicated in this kind of situation, right? Because again, these pills contain estrogen. Estrogen increases your likelihood of blood clotting, right? So the DVT can complicate much further, right? So that's why it's contraindicated in deep vein thrombosis. So apart from deep vein thrombosis, we have maybe you have current active cancer, right? For example, you have cancer currently. It is contraindicated. Why? Again, combined oral contraceptives contain estrogen. Estrogen can potentiate the growth of this kind of cancerous tissues, right? So again, if you have current cancer, you are not supposed to use combined oral contraceptives. Yes, yes. Again, if you have breast cancer, currently, or maybe you have a history of cancer in your family, again, it's contraindicated. Why? Estrogen. Combined oral contraceptives contain estrogen. So again, it can complicate or it can potentiate the growth, right? So it can potentiate the growth of the cancerous tissues. Apart from current breast cancer, apart from current active cancer, apart from less than 3 weeks post delivery, again, there are other conditions. For example, you've been having diabetes for the last 20 years. So diabetes mellitus for a period of greater than 20 years. Again, this combined oral contraceptives are indicated. Why? In diabetes, for example, you have diabetes for a long period of, for example, 20 years or so. Diabetes are, for a long period of time, damages your blood vessels, right? So after maybe a period of 20 years, your blood vessels are damaged, right? Again, you're taking estrogen. The combined oral contraceptive combination of estrogen and progesterone, right? So this estrogen causes of blood clotting, right? So again, if you have diabetes for a period of longer than 20 years, or let's say 15 years onwards, combined oral contraceptives is contraindicated, right? Yes. Apart from that, we have maybe you have heart disease, what we call ischemic heart disease, right? So ischemic heart disease, again, combined oral contraceptives is contraindicated, I mean, right? Because it can increase the chances of heart attack or what you call myocardial infection because of increased chances of blood clotting, right? Yes. So you are suffering from heart disease. You should not use this kind of pills, right? Yes. Apart from that, we have migraine. We have migraine plus horror. So what do we mean by migraine plus horror? Migraine, that is migraine that comes with we have plus you have visual disturbance, right? You have speaking difficulties, right? So you have migraine plus a combination of speaking difficulties plus a combination of maybe visual disturbance, right? So again, these pills are contraindicated. You should not use them, right? Why? They increases chances of stroke. They increases chances of what we call the cerebrovascular accident, right? Why? There's increased chances of blood clotting. Estrogen increases chances of blood clotting, right? So again, if you have migraine, you're suffering from severe migraine, you should consider other choices of family planning, right? You should not use combined oral contraceptives, right? Because it increases the chances of stroke. Yes, through increased chances of blood clotting. Yes. So having mentioned that, this kind of conditions does not limit you for the kind of it limits you the kind of contraceptives that you can use, right? So you can consider other options apart from the combined oral contraceptives. You have other types of family planning, right? So if you have diabetes for a period of greater than 20 years, if you have hypertension, right, you should consider other choices, right? So, apart from hypertension, apart from diabetes, apart from postpartum period less than 3 weeks, there are also women who are greater than 35 years old, right? And they are smoking, right? So again, if you are greater than 35 years old and you are a woman and you are smoking, right? You should consider other options. You should not use combined oral contraceptives, right? Because again, it increases the chances of heart attack, right? It increases the chances of blood clotting. If you have blood clotting, the chances of suffering from heart attack are very high, right? So if you are a woman, a lady, you are greater than 35 years old and you are smoking, right? You should consider other forms of family planning. You should not use combined oral contraceptive. Why? Because they contain estrogen. Estrogen increases the chances of blood clotting, which may complicate to heart attack, right? Yes. So I've mentioned some few things. We've said postpartum period less than 21 days. We've talked about hypertension. We talked about diabetes for a period of greater than 20 years, right? And we talked about heart attack. We talked about a woman, maybe a lady who is smoking and cigarettes at 5 years old. So you should consider other options, right? Yes, you should not use combined oral contraceptive. What we are trying to avoid is estrogen, right? So combined oral contraceptives contain both estrogen and progesterone, right? Yes. So this estrogen increases chances of blood clotting. So you should consider other options. So having mentioned that, leads me to the final part of my video, right? So I hope you learned something. I hope it was some sort of learning, right? Yes. So if you have not subscribed, please remember to subscribe. Let's see each other in the next video.